It's the law. You must have health insurance. But what about those people that can barely afford food, much less health insurance? Well, there is an answer, and we're talking today to Bob Godthaab, who is a part-time employee of the Green River Area Development District dealing with this issue. Bob, thanks for joining us today.
I'm glad to be here, Kirk.
Thanks. You help people sign up for the Affordable Care Act. Why is this important, and how did they do it?
Well, I started with Green River Ad in January, and that was the opening of the enrollment period for the Affordable Care Act, which actually was in October. Started signing folks up, and we met in various places in all 7 counties, actually, that Green River Ad supports. The period then closed March 31st. The enrollment period closed at that point. But Kentucky is one of 44 states that has expanded Medicaid. So folks who do not have health insurance at this time and feel as though that they are low income, they can sign up for Medicaid if they do not have it at this point. So even though, they don't have it at this point, they can still sign up. And the new enrollment period is opening November 15th for those folks who don't have health care, or if their situation changes where they have lost a job, they can go back into that enrollment period and reapply for affordable health care.
For those that don't know, what's the difference between Medicare and Medicaid?
Well, Medicare is for anyone age 65 and over, and Medicaid is for low-income folks.
So many people thought that the enrollment period was over, but it has been extended. How can those in need qualify this late?
Well, an individual who does not have health insurance and is low income can apply for Medicaid. An individual may call GRAD. We have a number and they can set up an appointment. Or actually, we are at the help office on 4th Street in Owensboro 4 days a week. The help office is the first stop that low-income people come to. They are interviewed. They fill out an application. And this is where they can qualify for food as well as clothing. And we are there also to help them sign up for Medicaid if they do not have Medicaid at this time.
We're talking to Bob Godthaab, who works for the Green River Area Development District. His primary job is to help those that could qualify for Medicaid and get health care insurance as required by law under the Affordable Care Act. Do you deal with those with really great needs, Bob?
Yes, Kirk. I've seen folks come into that help office on a daily basis that say, I have never been here before. I don't want to ask for help. I have 2 jobs and I just lost one. I'm a school bus driver and I'm also have been working cleaning offices. And then all of a sudden the individuals who owned a particular office decided to go with a different cleaning service, and I'm out of a job. And this lady was supporting, a couple children, and she felt like she needed health care. She didn't have it because she lost it, or her employer did not provide anything for her at that time, and so it was a desperate situation for her. And so I have seen a number of people come through the help office in that kind of a predicament. They need that extra help.
So this is really designed as a safety net. That was another reason it was extended, and that the open enrollment continues now for those that qualify.
Yes, that's correct. The open enrollment is there for Medicaid only at this point. The new open enrollment begins November 15th for folks who are able to pay for health insurance.
What qualifies as low income?
There's a cutoff. I believe it's somewhere around $12,000 a year if an individual's making $12,000 or less. It's in that vicinity of $12,000 to $13,000, $14,000. Everything that we do for signing an individual up for Medicaid, of course, we process everything through a computerized system through the state, Connect. It's all done through IRS and databases.
So there are safeguards against abuse. Do you still see people trying to abuse the system?
I don't. The individuals who come to me to sign up bring in a paycheck stub, or they have a W-2 form, and so we enter that information into databases, and then all of that comes back to determine whether or not the individual qualifies for Medicaid.
I think there's a misconception on the part of many taxpayers that the Medicaid program pays a lot of money out to people that may not need it, and it actually costs a lot more than it's worth. Do you agree that's a misconception?
Yes, I think that's a misconception. Kentucky is one of 44 states that has decided to expand Medicaid, and the federal government is footing the bill through 2016, as I understand it. It's much better for the taxpayer to have an individual on a Medicaid program as opposed to someone who doesn't have any kind of health insurance at all and just goes into the emergency room, then those costs are written off and passed on to the taxpayers.
When you go home at night, do you have a sense of satisfaction of helping these people?
Well, I'm a retired educator, and I've always wanted to help students and adults along the way, and I'm not doing this for the money. I'm doing it because I enjoy working with people and helping individuals who are really in the need of, in desperate times.
Well, spending 3 or 4 days a week at the help office, I'm sure that opens your eyes as well. You don't have to travel there very often to get a real sense of the need here in our community.
Oh, that's for sure. There are anywhere of upwards of 20 people a day that I see go through those lines. My office has been set up as that's the go-to place for us, and I see any number of people go through those lines 3 to 4 times a week, and upwards of 20 to 25 people requesting help. I try to indoctrinate them with an education concerning health care, that if they don't have the health care, they can sign up right there in the help office.
So is the starting point for someone in need or with questions calling GRAD or stopping by the help office?
Either is fine. GRAD has, individuals, the receptionists can take the information and we can contact them. The number of GRAD is 926-4433. Stopping at the help office Monday, Tuesday, Thursday, or Friday, anytime from 9 until 11:30 or noon, is also fine.
Bob Godthaab of Green River Area Development District, helping those people in great need with Medicaid and the Affordable Care Act. Bob, thanks for joining us this morning.
Thank you, Kirk.